Learn more about how SetPoint Therapy works by visiting setpointmedical.com. In this video, we will focus on the RESET-RA clinical trial that answers the question of how well it works for people living with RA. SetPoint therapy is a different approach to treating RA. Instead of suppressing the immune system, this approach is designed to activate the vagus nerve to help regulate inflammation. RESET-RA evaluated the safety and effectiveness of SetPoint therapy for treating RA in a randomized controlled trial, a study that compared people who received SetPoint therapy to those who did not. This kind of study is one of the most reliable ways researchers have to understand whether a treatment truly works. It helps show whether improvements are real and not just due to expectations or chance. This trial enrolled all its patients entirely in the United States. All patients in the trial were adults with moderate to severe RA who had not responded to or could not tolerate one or more biologic or JAK inhibitor. Approximately 40% of the study participants had experience with just one prior biologic before entering the study. Similar to studies of RA medications, the primary measure for RESET-RA was 3-month ACR20 response, which is meant to represent at least 20% improvement in multiple measures such as joint pain and swelling, physical function, pain, disability, patient's overall rating, physician's overall rating, and blood test measuring inflammation. The RESET-RA trial demonstrated that those who received active SetPoint therapy were more likely to have a better response compared to those who didn't at 3 months, with improvements over 12 months. The researchers also observed that participants with just one prior biologic exposure had stronger response rates at 3 months. Even those with multiple prior biologics saw a robust response to SetPoint therapy by 6 months, with response in majority of patients by 12 months. The study also measured joint pain and swelling, as well as the therapy's impact on disease activity and the patient's ability to stay on their therapy. At 12 months, 98% of the patients continued with SetPoint therapy, and 75% of them were managing their RA without adding a biologic or a JAK inhibitor. These patients had, on average, 60% reduction in the number of painful and swollen joints over 12 months. Achieving low disease activity or remission is often the ultimate goal for those living with RA. The trial showed that more patients receiving SetPoint therapy were in low disease activity or remission at 3 months, compared to those who were in the control group. By 1 year, approximately half of patients reached low disease activity or remission, demonstrating ongoing disease control and meaningful impact on patients' RA. The safety of the SetPoint therapy was also carefully evaluated in the trial. A clinical trial looks at all issues, big and small, that a patient experiences during the time they are in the trial. Device-related side effects, those deemed to be associated directly with the therapy, were infrequent and typically mild or temporary, with vocal hoarseness most frequently reported. Serious adverse events that were related to the device or therapy were uncommon, occurring in fewer than 2% of patients, and occurred within 3 months of device placement. Importantly, there were no long-term serious adverse events related to the device or therapy, and no serious infection, cancers, or major cardiovascular issues related with the device or procedure that occurred during the 12-month trial. Researchers concluded that SetPoint therapy produced durable clinical benefits with a favorable safety profile for patients with moderate to severe RA who do not respond to or cannot tolerate advanced RA therapies like biologics or JAK inhibitors. Every RA journey is different, and treatment decisions should be made in partnership with a rheumatologist. Learn more about the RESET-RA clinical trial and SetPoint therapy to see whether this option may be right for you.